Hey, everybody, this is Amy Register with my mom, the home healthcare mentor. If you don't know her, this lady is going to be the greatest source of free information for you today that you've ever had on star ratings. We're going to talk about what a star rating is. Of course, you know that things are rated by stars, but what does it mean to you in your business, your bottom line? So, welcome this morning to Teresa Register. Mama, tell us about the star rating system for home health care.
Okay. Well, in our industry, we're really good at coming up with all these letters that represent something that's a very long name.
Uh-huh.
So this really is about the consumer assessments of healthcare providers and systems, also known as CAPS. And there are CAPS surveys for all types of healthcare facilities and programs. So in home health, it's called HCAPS or HHCAPS, which stands for Home Health Care Consumer Assessment of Healthcare Providers and
Woohoo! That's a
Systems.
mouthful.
So yeah, so this is where the star ratings come from, and the actual program, the HHCAPS or HCAPS, is a national standardized and publicly reported survey process. And it depends on two different kinds of CMS rating systems. One of the rating systems is designed to give us information about patient satisfaction with the home health services that they've received from their provider. And the second part of it, or the second system, is an objective measurement of the quality of care that's reported to CMS through
Okay.
through standardized reporting.
So one part is just like, do people like you? And then the other part is actually measured against standards.
Yes,
All
there's
right.
some specific outcomes that are measured at the time a patient is admitted, and then at various times during the care, and any improvement or decline that is picked up in those reports from one time period to another. So those are the objective measurements. So just a little historical background. The surveys were first implemented voluntarily in 2009, and the requirement for continuous data collection began in October of 2010. Beginning in 2012, the survey results began being publicly reported. And at this point in time, anyone can view an agency's star ratings, and those ratings range from 1 to 5 stars, with 5 being the best possible. So, about the survey itself, it can be completed by a patient, a caregiver, or another person who is responding on the patient's behalf. And sometimes surveys are completed by mail, sometimes by telephone, or it could be a combination of both. And the questions are, there's quite a few of them. There's over 30 questions, and they cover things like communication with their care providers and with their provider services through the agency's on-call system, as well as through the staff that take care of them. It covers things about pain management
Mm-hmm.
and prescription medication use. But basically, it is a public relations process of measuring how happy they are with the various aspects of their care.
Got it.
So, answers to the survey questions, when they are preparing them for public reports, they put them into 3 different categories. And those are, first of all, the care of patients, secondly, communications between providers and patients,
Mm.
and third, specific care issues. And then they also measure two other overall measurements. The first being overall rating of the home health agency, and secondly, would you recommend the agency to family and friends? And obviously, that last one is really important. Would you recommend this agency to family and friends?
Mm-hmm.
So, that's kind of what the survey involves and what they're looking at through that survey.
Okay. Well, it doesn't seem too insurmountable to be able to get a control on these things. Who sees them? What do these star ratings help decide?
Okay. Well, as I mentioned, these are available online to anyone in the public. So anyone and everyone who wants to see them can get to them. So, in addition to government agents that are monitoring agencies for the value of the outcomes of services,
Mm-hmm.
your referral sources, your competitors,
Wow.
your patients, their family members, and insurance companies are some examples of people who might want to take a look at those. And of course, surveyors can see your agency star ratings before
So
they come to your agency.
it's like probably the general public knows less about where to find these. They're looking at your Google and Yelp reviews, maybe, but if somebody cues them in, they'll look. But it sounds like people that do business with you and, like you said, your competitors are going to be all over that.
Yes, I can tell you that most agency owners and or administrators know exactly what the star ratings are of their competitors.
Mm-hmm.
So, and it really does have a lot to do with your public image at this point. So your referral sources, meaning case managers at the hospitals that are doing discharge planning, um, or social workers. It can be nurses or social workers that are looking to see, who should I refer these people to that have a good reputation. Insurance companies will contract with agencies that have a high star rating before they're likely to, have a contract with someone who has poor star ratings or just mediocre star ratings.
Do they do
So,
half stars in this industry?
well, they used to, but they but they stopped that because they couldn't. There weren't enough objective measurements to differentiate between, say, 3.5 and 4, or
Oh,
three
okay.
and 3.5. But it did start out early on. They did have that half ratings, but at this point, I think the decision was that there's just not enough difference in the measurements objectively. So, yeah, on a
Okay.
scale from 1 to 5, it is difficult to get a 5-star rating,
Uh-huh.
um, but obviously it's the goal for every agency.
Does it grade on the curve too, where it's like difficult to get a 1-star rating and it's difficult to get a 5, but everybody lands on 2, 3, or 4?
Um, I'd say for the most part, what I usually see is probably a 3.
Okay.
Um,
Is it
fours are,
embarrassing if you have a 2? Like
oh,
it
I would
That's
say
bad,
it would,
right?
yeah, I'd
Okay.
say that's it's pretty sad
All
to get
right.
a 2-star.
So if you're listening to this and you have a 2-star rating, I'm sorry. We're gonna move on to um, how we can help you improve here in a minute. And if you're listening and you're all full of yourself because you got that 5-star, you better call us for an interview. We would love to hear how you got there.
So, so yeah, your star ratings do matter. They matter a lot. Being able to, as I mentioned, being able to get contracts to provide care to certain insurance companies, beneficiaries, they're going to be interested in your star ratings. It gives you bragging rights, basically. It gives you something to say. We don't just tell you we're good. Let us show you how good we are. And so when you have people that are trying to negotiate a contract or uh, going, to do public speaking in your community to promote your services, which is usually called community education,
Hmm.
it helps to be able to uh, refer to your agency as a 5-star or whatever kind of rating. So definitely, if you are a 5-star, that's really good information to be able to put out there publicly.
Yeah, you should be talking about it. Maybe even wearing a little pin on your shirt about it.
So one of the so yeah, some what are some of the strategies to improve your star rating?
Yeah, help
Obviously,
help these brothers and sisters out.
yeah, the strategies really get down to what are your patients really asking for. So that first type of survey that involves the patient's satisfaction, that's where
Hmm.
you can really, really make a difference easily. That's
Hmm.
the easiest place to improve. And of course, you want this whole topic to be part of your quality assurance program in your agency. You want whoever is chairing that committee to know where your star ratings are, and that committee as a whole really needs to break down um, any information that they get about why their star ratings may be lower than they should be.
I feel
So
because it's like some people get all the curmudgeon-y like patients in town who are just not happy with anything. I would feel so sorry for that guy.
so so you really want to make a difference in what you might think are sort of insignificant or small ways. So, number one, put something in your admission packet to your patients about star ratings, what they are, and and make sure that especially if you're a 5-star, you want to put that in there. And what does this mean? And you might be asked to respond to a survey, and here are some of the topics you might be asked about. So inform your patients.
Hmm.
Also, train your staff. Hire good staff, but then train them. Educate, educate, educate. Most employees know almost nothing about star ratings. They don't know where they come from. They don't know what the HH or HCAPS uh, term means. So when when you are hiring, there's so many things that you have to train your staff on, but at least introduce them to this concept and how your star ratings impact their job.
Hmm.
If your agency is doing well, it's growing, it's got a good reputation, you feel really good about working for that agency, and you're
Hmm.
likely to ooze that to patients and people in general. If you work for a company that's got poor star ratings and you know that, then you should be part of trying to fix that and make it better. So hopefully agencies are training staff on how they can help to improve the star ratings. And um, I'm going to tell you a couple real specific things that I think would help. So, every agency is required to have staff available on a 24/7 basis. If you are the nurse on call, one of the main uh, issues around patient satisfaction is how we handle after hours calls. If you are the on call person, it's really important for you to respond quickly and well to after hours calls from patients or their family members,
Mm-hmm.
especially if your answering service gets in touch with you and says there's a patient in pain, or they've got something serious going on, please get back to them. So your response time to after hours calls is real important. Secondly, how you respond to complaints that come into the agency, how quickly you contact the person who's registered the complaint, how thoroughly you investigate, how quickly you get back to them with a resolution. Patients understand that every organization's probably going to have some kind of problems from time to time, but how
Mm-hmm.
you respond to that, how quickly you respond, how thoroughly, and how well you take care of the problem is going to make a big difference.
Yes.
So, yeah.
Good stuff.
So you also want to, in your QA committee, you want to focus on any low scoring questions that pop up in your report, and do a root cause analysis, and look at those issues and focus on those as part of your QA improvement program.
Mm.
For example, if your agency's score on medication management is low, then you really want to focus on what do we need to do to improve in our working with patients on medication management. Do we
Mm-hmm.
need to do better education? When we first go out and see and admit a patient, it's important to understand that patients, when they're first being admitted, they are overwhelmed with information. So,
Mm-hmm.
so it's good to have something in writing about their medications. If you are getting a referral and you see a list of medications, pull some medication information sheets, and they probably will get some from the pharmacist, but try and get some that are a little more patient friendly. And
Yeah, we just throw those ones away from the pharmacy.
yeah, they're
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 tiny.
scary.
Yeah.
So and there's probably there's probably a need for front loading your visit frequency, understanding that the patients are probably not going to be able to retain a lot of teaching your first visit, and frankly
Mm-hmm.
the nurse that's doing the admission won't really have enough time to go into some of the medications. It's I think about how many medications many of these patients are on. I've seen them 20 some medications. There's no
Wow.
way someone can teach on that that long list of medications
Yeah, that's
on
huge.
an admission visit. So, yeah. So, medication management is usually one of the big challenges that an agency has. So, focus on any of your low scores, and pick apart, what the problems are. And then, as a committee, it's important to make some, very specific recommendations. Don't try and fix everything, but try and fix
Mhm.
something as far as your low scores.
Yeah, that's good advice for life. Just keep picking them up, putting them down, make a
Make
couple of
improvements.
goals. Yeah,
Right.
celebrate when you get there. I think,
Right.
your agency with your, staff retention and, all the things that you do to say thank you. You can have a star party, or you could give out badges when you reach a certain thing as a an agency. I could just see working that into a lot of celebratory stuff.
Right. So, yeah, reward your staff when you hit those marks. Let them know that they're making a difference. Keep them up on the changes, and again, that's part of that constant education of staff. when you see a movement in the scores, they need to get a pat on the back. They they helped make that difference, so they should be recognized and acknowledged.
I know we
Um,
were trying to keep this one a little bit shorter, but I wanted to backtrack because I don't think we talked about how frequently these are updated. Um, is it
how
annually?
frequently how frequently the star ratings get
Yeah.
updated?
Mm-hmm.
Well, honestly, it varies because especially during, the last year or so, there there has been a problem getting getting that information updated. Um,
But
I
generally,
well, generally, I would say you're going to hear quarterly how you're doing.
okay.
So, it there's sometimes some significant lag time depending on CMS and their ability to pull the data together and report it. But yeah, be advised that um, whatever your most recent one is going to stay up for a while. So yeah, you'll just have to track it and see when they're updated. I know the agency I work with, we had, a fairly lengthy time between those reports getting out. So,
Yeah, I think that was my main goal, is that I don't want people to feel like the positive side is that if they change regularly, you're not stuck. If you got a poor one, you can see incremental movement quickly. But if they're going infrequently, then it's a little bit scarier because you could get stuck with a 2 or 3 star rating. um, if you make vast improvements over a year, it's not going to reflect. So that's why I was wondering.
yeah, it's normally it's more frequently than annually, but it
Okay.
has varied from time to time just because of things going on. I guess the reporting uh, isn't always timely.
Yeah.
So, so another thing that I think really makes a difference with your patient satisfaction is paying a lot of attention to the first week or so of a patient's admission to your agency. It's kind of I would kind of relate it to when you go into a restaurant and you're putting through your order. When your order comes, you have some kind of a response to what's on your plate, and so it might look nice, but then maybe you taste it and it either has too much salt or not enough salt or whatever. And I think we've all been there where the waiter or waitress didn't come back and check with us and say, is your food okay? you know
Mm.
so relating that to home health, when the nurse comes out and does the admission, they go through the process, it's overwhelming. That's not, the patient's just kind of going to be in shock. So, what you want to do is check back with them after the first couple days or so and
Mm-hmm.
and have someone call them and say, how are things going?
Oh,
What do
yeah.
you need? you know, is there something else that you're feeling a need for? Should we have someone come out and see you? Those kinds of things. Because the first few days are just really a blur. And so it's important to follow up after that admission. And some agencies will actually designate some office staff to call patients and just check in with them. And then if there is a problem, then they refer it to the case manager to follow up with a phone call to really get down to, the specifics about what the patient needs.
Yeah, that's so nice. I can't imagine anything better because it's kind of hard to talk to the person who's giving your care. It's a little confrontational, especially if you don't really know. Like, that would be hard for me as a patient, or, the mother or whatever caretaker. in-home caretaker. But if somebody gave me a call and said, hey, let's think over these things, be a little reflective, how's it going? That would make me feel a whole lot more free to share and ask questions. So that sounds
Right.
like
And
an awesome thing.
right. And if you're the person calling, it's important to have, of course, the right person do that kind of a call, because it should come across as being, very helpful. And if you have any problem at all, we want to know, because we can't fix something unless we know about it. So please don't feel like you're complaining. We
Right.
just, we just really want to know if there's something else we need to pay attention to. So
Yeah. Listening and
that,
learning is the point of the call, not telling the
yes,
not arguing that of course your nurses are great and they're doing things right. Just listening.
yes. Your job at that point is to hear what the patient's needs are and to assure them that you will pass on the information to their case manager, who will call them and do a little, problem solving with them. So
Love it.
that one thing has been shown to make a huge difference in patient satisfaction. So, if
Cool.
there was one thing or two things, I'd say, yeah, pay attention to your on-call staff's response time. And I will tell you, when I started as a home health director at an agency, I our policy said that we would respond to those calls within an hour. And I was appalled. I said, if I was the patient or a family member and I put through a call after hours, I've already waited a while before I wanted to, quote, bother somebody. So I'm already into this problem for, a while. Waiting another hour to me was just not acceptable. So I did some training with the staff. I said, okay, if you were the patient, how quickly would you want a call back? And of course, the response was 5 minutes. I'd want to hear back from somebody. And so we made it one of our QA initiatives and said, okay, let's see what we can do. We got the call back down to less than 3 minutes.
Wow. That's
And
something to brag about. Like that's something I'd put in my brochure for sure.
well, if you maintained it for, a certain period of time and you could brag about it,
Yeah.
absolutely, you would brag about it. So the response time, and then another thing, as far as your answering service, one of the other things that we did where I was we asked our answering service staff to check back with anyone who called requesting the nurse. We we checked back with them in about 20 minutes to see if the nurse had contacted them yet. If not,
Mhm.
we escalated, elevated, whatever, the
Yeah.
the issue to an on-call clinical administrator, who would then, decide if it could wait or it needed more prompt attention,
That's
and they would
awesome.
then problem solve. So those are some things that, as you can imagine, if you're the patient, maybe you had surgery and you're home and you're in pain, and or a hospice patient who needs a pain medicine, and um, the care provider is out of syringes, or whatever. You need to know as soon as possible how to fix that problem. So it's important to understand, that's critical to patient satisfaction. How quickly you respond when they're crying for help is huge. So if you want to improve your star ratings on patient satisfaction, that's important to pay attention to. Um,
Awesome. Well, we're
yeah,
coming up to the 30-minute mark. I think we've had a really good training on some of these lessons. I think if you're an admin and you catch this, this could be part of your training. Send it around in your email. Is there anything else that you wanted to highlight before we cut it off?
Well, no, I think those in and of themselves would make a huge difference in the patient satisfaction portion.
Mhm.
As far as the objective care, it obviously is another area of training that your staff really needs to understand, because sometimes there's just a little difference between the scoring of these objective measures, and
Mhm.
you want to make sure that you're not just hiring a clinician and assuming that they know how to fill out their OASIS questions. You want to make
Mhm.
sure that you do thorough training as far as the objective portion and the patient satisfaction. Today, I just kind of focused heavily on the patient satisfaction issues, but keep in mind that there's the objective section. So, hire good clinicians, train them well, monitor your stars, get your QA committee looking at your results, and focus on where you have the biggest issues. And then watch the results and share those with your staff. So educate, educate, educate.
Yeah. Awesome. Well, I learned a lot today. Hope you guys did too. I want to remind you that we have helpful things over at thehomehealthmentor.com. I showed you this last week, but we also have fun stuff there. Working on a couple other t-shirt designs, but primarily information products there. And always, if you've got questions on this topic, um, you can probably Facebook message Teresa or put a comment under this. I think the message would be more apt to get seen quickly. But thanks for joining us today. This was fun. Thanks, Mama.
You're welcome. I hope it was helpful.
It was for me. I want more stars. All right. We'll see
Okay.
you guys next time. Thank you. Bye
Thank
for now.
you. Bye bye.